Welcome to our comprehensive guide on home care services. Today, we'll explore the various types of care available, who can benefit from them, and the numerous advantages they offer. As a medical professional, I understand the profound impact that the right support system can have on an individual's health and quality of life, especially when that support can be provided within the familiar and comforting surroundings of one's own home. Making decisions about care, whether for yourself or a loved one, can often feel overwhelming, and my goal here is to demystify the options and empower you with knowledge. Throughout my career, I've seen firsthand how tailored home care can transform lives. It's not merely about addressing medical conditions, it's about fostering independence, preserving dignity, and enhancing the overall well-being of individuals who may need assistance due to age, illness, or disability. The ability to remain at home, surrounded by personal memories and comforts, while receiving professional and compassionate care is invaluable. This approach acknowledges that health is multifaceted, encompassing physical, emotional, and social aspects, all of which can be nurtured effectively through dedicated home care services. We'll be looking at how these services adapt to very personal needs. In this video, we will journey through the different facets of home care, breaking them down into understandable segments. We'll discuss specialized medical care that can be delivered at your doorstep, the essential personal assistance that supports daily living, the practical help with household tasks that maintains a safe and comfortable environment, and the crucial emotional and social support that combats isolation and promotes mental wellness. My aim is to provide you with a clear, in-depth understanding so you can make informed choices that best suit your unique circumstances or those of your family members. Let's begin this important exploration together. When we speak of medical care at home, we're referring to a suite of services delivered by licensed healthcare professionals designed to manage health conditions, aid recovery, and provide ongoing medical support outside of a traditional hospital or clinical setting. This is particularly vital for individuals recuperating from surgery, managing chronic illnesses like diabetes or heart disease, or those with complex medical needs that require regular monitoring and intervention. Nursing care, for instance, forms a cornerstone of this service. Registered nurses or licensed practical nurses can administer medications, including injections, monitor vital signs meticulously, manage intravenous therapies, provide education on disease management to patients and their families, and perform other skilled nursing tasks that are crucial for stable health and recovery. Physiotherapy at home is another essential component, focusing on restoring movement and function for individuals affected by injury, illness, or disability. Imagine the convenience and comfort for someone recovering from a joint replacement or a stroke to receive personalized rehabilitation exercises in their own living room. Home-based physiotherapists assess the patient's environment, tailoring exercise programs to improve strength, balance, coordination, and mobility, while also teaching techniques to manage pain and prevent further injury. This personalized approach not only accelerates physical recovery, but also empowers individuals to regain independence in their daily activities, adapting the therapy to the real-world challenges they face in their own space, which is a significant advantage. Occupational therapy, often working in tandem with physiotherapy, plays a critical role in helping people participate in the things they want and need to do through the therapeutic use of everyday activities. For someone who has experienced a decline in physical or cognitive abilities, an occupational therapist can assess their home for safety and make recommendations for adaptive equipment or modifications. They work with individuals to relearn essential daily tasks such as dressing, cooking, or managing personal hygiene, or to find new ways to perform them. The ultimate goal of occupational therapy at home is to enhance functional independence, improve quality of life, and enable individuals to engage meaningfully in their daily routines, fostering a sense of competence and self-sufficiency. Finally, specialized services like speech therapy and wound care are indispensable for certain conditions. Speech therapists can work with patients at home who have difficulty with communication due to stroke, brain injury, or other neurological conditions, or those who experience swallowing problems known as dysphagia, which can significantly impact nutrition and safety. Meticulous wound care provided by trained nurses is critical for patients with surgical wounds, pressure ulcers, or diabetic foot ulcers. Proper assessment, cleaning, Dressing and monitoring of wounds at home can prevent serious infections, promote faster healing, and reduce the need for hospital readmission, ensuring that recovery progresses smoothly in a supportive and familiar environment. Personal care services are centered around providing assistance with activities of daily living, or ADLs as we often call them in the medical field. These are the fundamental tasks essential for self-care and maintaining personal hygiene, and support in these areas can make a profound difference in an individual's ability to live comfortably and with dignity in their own home. This type of care is particularly beneficial for seniors, individuals with disabilities, or those recovering from an illness who find these tasks challenging. For example, assistance with bathing or showering and help with dressing and undressing are common personal care services. Caregivers are trained to provide this support respectfully and discreetly, always prioritizing the comfort and preferences of the person they are assisting, ensuring a safe and dignified experience. Another critical aspect of personal care involves assistance with eating and medication management. For some individuals, the physical act of eating can be difficult, or they may require encouragement and support to ensure they receive adequate nutrition and hydration. Caregivers can help with meal preparation, setting up the meal, and providing feeding assistance if needed, all while fostering a pleasant dining experience. Equally important is support with medication. While caregivers typically don't administer medications unless specifically trained and licensed to do so, like a nurse, they play a vital role in providing reminders for prescribed medications, ensuring doses are taken at the correct times, helping with opening containers, and observing for any immediate side effects, which is crucial for managing health conditions effectively. Beyond these core activities, personal care can encompass a range of other daily tasks that contribute to an individual's well-being and independence. This includes assistance with toileting and incontinence care, which is handled with utmost sensitivity and professionalism to maintain dignity. Grooming tasks such as hair care, shaving, and oral hygiene are also part of personal care, helping individuals feel good about their appearance and maintain their self-esteem. Furthermore, mobility assistance is a key component involving help with transferring from a bed to a chair, moving around the home safely, or providing support during walks. This not only aids in physical well-being, but also helps prevent falls, a common concern for many. The relationship between the caregiver and the individual receiving care is paramount in the realm of personal care. It's built on a foundation of trust, empathy, and consistent communication. A good caregiver understands that they are not just performing tasks, but are there to provide companionship, emotional reassurance, and a sense of security. They learn the individual's routines, preferences, and personal history, tailoring the care to meet their specific needs and wishes. This holistic approach ensures that personal care truly enhances the quality of life, allowing individuals to remain in their cherished home environment while receiving the support they need to live as fully and independently as possible. Chapter 3. Home Care, ensuring a safe and comfortable living space, also known as homemaking services. Homemaking services, often referred to simply as home care, focus on maintaining a clean, safe, and comfortable living environment for individuals who may find it challenging to manage these tasks on their own. This aspect of support is incredibly important because our surroundings significantly impact our physical and mental well-being. When a home is well kept, it reduces hazards, promotes hygiene, and creates a more pleasant atmosphere for living. Typical homemaking services include general house cleaning tasks such as dusting surfaces, vacuuming carpets and floors, mopping, cleaning bathrooms and kitchens, and tidying up living spaces. For someone with limited mobility or energy, having this assistance can be a tremendous relief and a key factor in their ability to remain at home. Laundry is another common household chore that can become difficult, and homemaking services often include comprehensive laundry assistance. This can involve gathering soiled linens and clothing, operating the washing machine and dryer, folding or ironing clothes and putting them away neatly. Having clean clothes and fresh bed linens readily available contributes significantly to personal comfort and hygiene. It's one of those tasks that, when managed by a caregiver, frees up the individual's energy for other activities or simply allows them more time to rest and recuperate. This practical support helps maintain a sense of order and normalcy within the home, which is especially comforting for those dealing with health challenges. Meal preparation is a vital component of homemaking services that directly impacts health and nutrition. While personal care might involve assistance with eating, homemaking extends to the entire process of planning and cooking meals. Caregivers can help create shopping lists based on dietary needs and preferences, shop for groceries, and then prepare nutritious and appealing meals. This is particularly beneficial for individuals who have specific dietary restrictions due to medical conditions, or those who lack the strength or motivation to cook for themselves. Ensuring access to regular healthy meals is fundamental to maintaining energy levels, supporting recovery, and managing chronic conditions effectively, all within the comfort of one's own kitchen. Beyond the core tasks of cleaning, laundry, and cooking, homemaking services can also include assistance with other essential errands that keep a household running smoothly. This might involve grocery shopping, as mentioned, but also picking up prescriptions from the pharmacy, mailing packages, or accompanying the individual to appointments if that falls within the scope of the service. By taking care of these practical necessities, caregivers help reduce stress and ensure that the home environment remains a sanctuary of comfort and support. These services are not just about maintaining a house, they are about supporting a life, enabling individuals to conserve their energy for healing, personal pursuits, and connecting with loved ones. Chapter 4. Support and Social Services, Nurturing Emotional and Social Well-Being. While medical and physical needs are often the primary focus when considering home care, we must never underestimate the profound importance of emotional and social support. As humans, we are inherently social beings, and our mental well-being is deeply intertwined with our connections to others and our sense of belonging. Home care services that incorporate support and social engagement address this vital aspect of health, aiming to combat loneliness, provide comfort, and foster a positive outlook on life. This can be as simple as offering companionship, a friendly face and a listening ear, which can make a world of difference, especially for individuals who may be housebound or have limited social interaction. Emotional support provided by a caregiver is a cornerstone of this type of service. Life changes, illness, and the challenges of aging can bring about feelings of anxiety, sadness, or frustration. A compassionate caregiver can provide a stable, reassuring presence, offering encouragement, empathy, and a non-judgmental space for individuals to express their feelings. They can help individuals navigate difficult emotions by simply being there, listening actively, and validating their experiences. This kind of support can significantly improve mood, reduce stress, and contribute to an overall sense of security and peace of mind, making the home not just a place of physical care, but also one of emotional sanctuary. Interacting with others and engaging in social activities are crucial for cognitive function and emotional health. Caregivers can play an active role in facilitating these interactions. This might involve engaging the individual in conversations about their interests, reminiscing about past experiences, reading aloud, or playing games like cards or puzzles. Depending on the individual's mobility and preferences, a caregiver might also accompany them on short outings, such as a walk in the park, a visit to a community center, or an appointment, providing both physical support and companionship. These activities help to break the monotony of daily routines and keep the mind active and engaged, fostering a continued connection to the world around them. Ultimately, these support and social services contribute immeasurably to an individual's overall quality of life. By addressing the risks of social isolation and loneliness, which are known to negatively impact both mental and physical health, caregivers help to nurture a sense of purpose, connection, and joy. This holistic approach recognizes that well-being extends far beyond the absence of disease. It encompasses emotional resilience, social fulfillment, and the ability to find meaning in daily life. Providing this kind of comprehensive support ensures that individuals receiving care at home are not just safe and physically comfortable, but also emotionally supported and socially connected, leading to a richer, more fulfilling life experience. Thank you for joining us in this guide to home care services. We hope this information helps you or your loved ones make informed decisions about the care you need. As we've explored, home care is a multifaceted support system designed to cater to a wide range of needs, from complex medical requirements to essential daily assistance and invaluable companionship. The primary goal is always to enhance comfort, promote independence, and uphold the dignity of each individual within the sanctuary of their own home. Understanding these options is the first crucial step towards finding the right solution. Making the decision to bring care into the home is significant, and it's natural to have many questions. I encourage you to carefully assess your specific situation or that of your family member, considering not just the physical tasks, but also the emotional and social well-being that contributes to a fulfilling life. Don't hesitate to reach out to healthcare providers, geriatric care managers, or reputable home care agencies in your community. They can provide personalized assessments, answer your detailed questions, and help you navigate the process of finding services that truly align with your needs and preferences, ensuring a tailored approach to care. Remember, choosing home care is about choosing a path that supports not only health, but also happiness and autonomy. It's about creating an environment where individuals can thrive, surrounded by familiarity and supported by compassionate professionals. The right care plan can make a profound positive impact. We sincerely hope this comprehensive overview has been enlightening and empowering for you. Stay healthy and take care.